oxygen plant project site at Edward Francis Small Teaching Hospital, which he helped to facilitate. Madam Barrow, who was accompanied by the Minister of Health, also toured the main referral hospital to get first-hand information on the progress of the ongoing renovation exercise. Our Mane has the rest of that story.
The Society of Critical Care Medicine's new Global Health Program, Africa Infrastructure Relief and Support, are teaming up to ensure availability of stable and sustainable medical oxygen to patients in the Gambia, Liberia, and Sierra Leone. The Edward Francis Small Teaching Hospital is the main focus of the collaborative process as the main referral hospital, where the project is implementing sites with all units expected to have new technological invented oxygen plants, facilitated by Her Excellency Fatoumata Barbaro. The initiative, funded by Direct Relief in collaboration with the Johns Hopkins University, Global Alliance of Preoperative Professionals and the Institute of Global Preoperative Care Unit, with a grant of $5.5 million, aims to provide standard and high-quality healthcare services to the Gambian populace. The implementation will involve the development of oxygen-generating plants, installation of oxygen piping within oxygen walls, as well as an in-depth biomedical for workers who will operate solar and oxygen-generating system to ensure sustainable provision of benefits for years to come. Speaking during the site visit, Health Minister Dr. Ahmadou Samate delved into the importance of the oxygen plants, citing many years of challenges facing using cylinders for patients.
In 2017, when His Excellency's government came into office, I was a hospital consultant here and head of Department of Surgery. There was a day in the early days that this hospital only had half a cylinder, half of one cylinder full of oxygen in this hospital. It was very scary because that was what was available for any operation, whether emergency, because we couldn't even do elective surgeries. So it was kept for emergency surgical operations. Now, apart from that, if we had gotten any patient on the ward who needed just little oxygen, he wouldn't have been able to get it. This is where we came from. Today we are talking of oxygen plants within the hospital. We are talking about piping that oxygen to where the patient is going to lie down and directly connecting it to any patient in the whole hospital when it is needed. I think that's a big plus.
Dr. Samate also talked about the improvements the hospital has undergone under President Barrow's administration.
Edward Francis Small Teaching Hospital is our main teaching hospital. We started the construction in phases of our 1,500 bed hospital at Farato. But before it's completed, we are using Edward Francis Small Teaching Hospital. Most parts of the hospital before were eyesores. They were not fit for purpose. And we said we need to modernize it, we need to expand it. That is why you're seeing all this beautiful development to standard. And this is what prevails in the developed countries. If you show hospitals in developed countries, they look just like this. So in our modernization process of the whole of this country, under the leadership of His Excellency, the health sector is not left behind.
Her Excellency Fatoumata Barbaro emphasized the importance of the project and range of benefits it will have on Gambian people.
This project is just not very important, but very, 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 very. If you can add thousands of very on it, it is very important. We have go round, you've seen that they were using cylinders, carrying cylinders, anything could happen, an accident can happen. If you meet up with some philanthropists like the critical medical care, who grab everything that they tell you. That was the reason why we did it. And as I was telling them yesterday, it was just like we were going to the river fetching water, going back to the house. Now that you build a borehole in your house, make sure you have taps all over the house. It's like you will just go to the tap, open, use, close, that's it.
The leader of the team of experts from the Johns Hopkins University, Dr. John Sampson, said the project is aimed at strengthening the Gambian health system by supporting adequate delivery system of oxygen.
We didn't want to give them used equipment, hand-me-down stuff. We didn't want to give them equipment that wasn't at the level that we would expect in the United States of America. And so we wanted to give them an oxygen delivery system that would be complete. Number one, that the technology would be one of the more advanced technologies for oxygen delivery systems. So the technology of the system that we chose would be one that would use 30%, only 30% of the energy of other systems, but deliver more oxygen and have fewer maintenance requirements.
Dr. Sampson further stated that a team of biomedical technicians from Ghana who are helping in the implementation of the project will train Gambian biomedical engineers on the operations of the oxygen.
We wanted to give them a system where there were pipes going to every bed of the entire hospital. That yes, it will take some work, it would take some construction, it would take some effort and energy, but this is what the government of the Gambia and the people of the Gambia deserve, to have such a system. That we will give them a system by working with our Ghana partners and Ghana biomedical technicians, that we would give them a system that will also give them medical air, because not every patient needs full oxygen. Some patients need partial oxygen. That we would give them a system that will also allow every person to suction at the bedside.
The First Lady and delegation toured the various oxygen plants and project sites within the hospital, with contractors assuring officials that the project will fully start operations by August 2024. Awamani, JHU News.
Vital intervention there by the First Lady. Now, Gambian pilgrims have successfully completed the rituals of the Hajj and are returning home. The flight carrying the first part touched down at Banjul